biggest challenge that I currently face is actually trying to apply a standard for legislation that's not actually in place yet. The US legislation is near enough there, it's supposed to be in place later this month, but there's no guarantees that what follows in Europe is actually going to be the same. There's already a couple of discrepancies from the information that the European Commission has given to member states, where it doesn't quite match what's in the US legislation. So that is going to be an issue going forwards if we want to be able to carry on trading globally. Barcodes and identification technology use within our business has not been very important up until recently. However, recently we've just undertaken a consolidation of our warehousing system, and we've started to scan products as they arrive at the warehouse, which is quite key for the company in trying to streamline our supply chain and save costs. Also, there is the fact that the customers are starting to ask us for GS1 standards within tenders and ask us for our G-tins. And the final thing is obviously the legislation coming into effect, which means that we need to start barcoding our products and making sure that they are compliant with whichever standard we choose to use. The next 18 months in terms of strategy for meeting objectives is a difficult question to answer really, because the legislation or the detail for the legislation is not in place. We know that we need to physically mark our products with a UDI. We know we're going to have to populate databases with certain attributes, but we don't have all the detail. So it's going to be very, very difficult to meet these objectives without the detailed information. I've always found GS1 to be very, very helpful, and when I have an issue that I need support with, I've come to GS1 and they've worked with me, especially within the healthcare sector and the healthcare user group. We've worked together to overcome the problems. I think the main thing for me is GS1 enforcing through the supply chain the use of the standards. Whether it's a service to go into hospitals and show them specifically the benefits that they will obtain from scanning a wristband and then the products and the healthcare workers, so that they've got that full traceability, because I don't think that within the trusts at the moment they have that specific knowledge.